Thank you very much. It's a real pleasure to be here, and Tricia's just given us such a fantastic start to the morning, because if you remember on the results we did see, mental health and stress came out as the very most important thing that keeps us from going to work. And she's just told us such a fantastic story of how we behave about mental health problems in the workplace. All right to go back after your knee replacement. Everybody is sympathetic and talks to you about it and doesn't run away. When you go back after depression or something, they don't quite know what to say. So I'm, in the few minutes I've got, just going to try and talk about having healthy workplaces. And this really is the strategic vision that the governments have had. And I said governments in the plural there, because the health, work and wellbeing strategy started in a previous government, but has been continued by this government. But I think we're all working to the same agenda. And when the cross-government strategy was developed in 2005, part of that strategy was to have a national director. It was a 5-year programme. So what I've been trying to do was to support, promote and deliver this strategic vision. The three most common causes, and we all know these, of keeping us from being in the workplace: common mental health problems, musculoskeletal problems, and then real diseases. I use the word problems very specifically because they're often not defined disease. And therefore, we all ought to be able to deal with them and get back to work. And we all know that that doesn't happen as well as it should. Organisation of work, the quality of line management is absolutely crucial, as of course is lack of education and skills. And then we do need to add into this deprivation and poverty and the unavailability currently of employment. People often say to me, Carol, what's the government going to do? Well, the government can do so much, but this is really about us all doing things. And I think the fantastic thing since my review has been I've seen in local communities fantastic effort, and you have that here, where in a way you don't need central direction anymore. The journey started, and the most important thing is you do it in the way that you most want to do it. It shouldn't be driven out of the centre. It should be coming from our localities, and I've seen that wherever I've been in the country. There is an elephant in the room to add to that previous slide, and we really should be conscious of the fact that we're now, I think, the 4th fattest nation in the world, and by 2025, 40% of us will be obese. That will have an effect on the workplace. And if we want to be competitive in a global economy, then only the healthiest businesses will prosper. So this is something we really, really do need to think about. And therefore, I think companies that invest in the supporting employees' health will be fitter to survive. If we fall out of work, this is the journey that many of us will take, and this is what has consumed my spare time and non-spare time since February the 10th of this year. It's looking at the sickness absence journey, just to remind you that the journey is that we're either in work, or we might be collecting statutory sick pay or occupational sick pay from our company. If we go beyond that period, we move into that assessment phase, often for whether we would go into one of the state benefits, the work capability assessment. That journey is all too easy. And what we've discovered in doing this review is it's easier to travel down it than actually stay close to the labour market. So when you see the review in a few weeks' time, what we've tried to do is look at the various places in that journey where we should interfere. And what surprised us all is you would think everybody takes that journey. Well, they don't. We have at least 140,000 people every year who go straight from work into the benefit system. So this week you're in work, and next week you're going to Job Centre Plus. There's something very, very wrong in a system that doesn't help you stay close to the labour market when you were in it a week or two beforehand. So there's been some very interesting findings in our review, which we will be addressing in our recommendations. And all that information is of course, the information that we've used for this review is from mainly from publicly held data. So the workplace and its potential, we know that it has huge potential, but I just wanted to give you a little idea of the journey we've still to travel. This is from DWP research from last year, researching with employers to say, right, your attitude to health and well-being amongst your employees. If you look at the top of this slide, it all looks fine. I think it's what we would expect. But could I draw your attention to the bottom line? You've all just said sickness absence is related to productivity, but this is over 2,000 employers. When asked, only 25% thought that sickness absence was a barrier to productivity. Now, I find that ridiculous, but what we do know is that not every company measures and monitors their sickness absence. So I think it's often not that that isn't a relationship, that we still have many companies who don't either record sickness absence accurately, and if they do not know what it costs them. So there's a long way to go there. We know what a positive workplace looks like, and really what Tricia has described, she was really describing, in fact, positive workplaces, people who helped you. And it's no use just putting the fresh fruit and veg out, or having an exercise class and just putting it round the edges and thinking, well, now I tick the box for health and well-being in the workplace. It's got to be embedded in every aspect of the organisation structure. It's got to come from the top. And it was fortunate that I put in a slide about mental health issues. This is using the Centre for Mental Health paper. But what I did do, I went back and asked myself, how many toolkits or training courses or guidance notes are there out there to help employers have good mental health, proactive mental health in the workplace, not reactive when you've got a problem? Well, I have to tell you there's over 100 that I've identified. So there's no lack of material that could be used. It's all there. It's whether people are really using it. Some of these toolkits and materials are absolutely excellent. So we can do it. It isn't that we need anyone else to write anymore. We just need to really, really use it. I'm going to give you just one or two slides from the public sector, because one of our charges in the sickness absence review was to look at the public and private sector in terms of sickness absence. So we've had to do a lot of work in that area. What I have found is an increasing number of very good examples from the public sector. It is very patchy, but I used to always use examples from the private sector because I couldn't find any from the public sector, but there are now really some beacons of very good practice. As you can see that the Audit Commission estimated that we could make a lot of savings if in the NHS we could reduce sickness absence just to the rates in the lower quartile. We are trying to do that, and most of you in the audience will know about the Borman Review. We have now got an implementation programme. We have identified national priorities. We are putting within the different health authorities, really, I suppose I will use the word targets, but we're asking them to reduce their sickness absence, if possible, by a certain amount, and we've got work streams to match this. I can't yet give you figures of progress, but we have got trajectories to improve sickness absence now from all the hospital and local health boards. The NHS Sports and Physical Activity Challenge is launched. There are toolkits, there's a web portal, and we've got the Public Health Responsibility Deal. So things are beginning to happen. Could I encourage you all to really use the NICE public health guidance? We've audited it in the NHS just to see how much it's been taken up. There's some excellent guidance there. It's evidence-based. Again, it's very patchy, but it shows very clearly that if senior leadership is involved, and where the boards of hospitals have taken this on board, it may have a champion or it's reported to the board, then those places have indeed a more productive workforce and better outcome for patients. I wanted to really press home, although I don't need to you today, just the excellent work that is going on locally and the very good work that Staying Healthy at Work is doing. And I've just chosen the Great Yarmouth Borough Council because I thought what they had done is just so excellent, and it's actually got facts and figures that I can use when I go around the country as an example of a council that has really made a difference. So annual sickness absence rate higher than the local government average. 7.5% of employees have a declared disability, and really funding was put in, and not a big amount of funding, to try and reverse this trend. And there you can see some of the early results. And I just really put this up to show that it can be done and one can actually produce the figures. And I very much hope that we will see more of this really around the country, of people saying it is possible, I can make the business case, and I can make a difference for the staff. And just very finally, to remind you that the Secretary of State for Health, Andrew Lansley, has been trying to move closer, and I'm delighted about this, into seeing the workplace as a very good place for good health, for promotion of health, and for the prevention of ill health. And Andrew has 5 networks: food, alcohol, physical activity, behavioural change, and health at work. And I've been chairing the Health at Work network. Just one slide on this. I won't go into all the details of all the work we're doing, but we do have pledges which you could sign up to. It is a pledge by your organisation that you are doing something for your staff. I don't think any of our pledges are really that difficult, may get tougher as you go down that list, but health and wellbeing reporting, including a section on health and wellbeing within your annual report or on the website, using the national standards for occupational health services. So I think some of these things are indeed not difficult. You only have to sign up to one pledge to start with, if that's what you would feel comfortable with. We've got 141 companies signed up. Finally, just the last slide, the Prime Minister announced this independent sickness absence review in February and told us we had to report by the end of October. The days are ticking by. We are online to report by the end of October. But I'm afraid I will have to leave you to catch the 11:15 train, because we've got the penultimate meeting of the reviewers to go through the draft as it stands at the moment. But we are going to make, I hope, some very reasonable suggestions for change.
Thank you.